Hello everyone, good day. I am Mrs. Priscilla. Today we'll be talking about research, audit, service evaluation and quality improvement. So today's content we will be diving a little bit more into the Mid Stratfordshire scandal. What is quality in health, nursing care? What is research, audit, service evaluation, quality improvement in clinical practice? How do we measure quality in our nursing practice? And Health Research Authority tool to assess whether a project is research or not. So before we dive into it, I just want to touch a bit more on the Mid Stratfordshire care scandal. Um, very sad incident which happened over 15 months between January 2005 and March 2009 at Stratford Hospital, a small district, general hospital in Staffordshire. I have put down the link. You can, click on the link and read more about it. But I decided to start with this because this incident or this scandal actually did raise, the report from the scandal did raise issue with regards to, healthcare professional negligence. There is a question with regards to the duty of our care. When we talk about duty of care, we talk about the legal duty to provide reasonable standard of care to protect our patients and prevent harm. There was issue with regards to inadequate staffing, especially with the nursing staffing in the UK at the time. There was issue with management cutting cost to be able to cutting costs with regards to providing best quality of care, which affected the care that was given to the patients. Unfortunately, very sad incident. There was issue with process of reporting incidents, and that overall affected the care, the quality of care the patients received, and as a result, quite a number of patients died. From the report, about 400 and 1,200 patients died. Very sad as a result of the poor care given to them. And this incident or scandal actually led to most of the trust or current NHS approach to dealing with quality assurance. Currently focus on providing safety culture and improving the quality of care we give to the patients. So very sad incident, and it's the reason why we've got quite a number of bodies to kind of regulate the standard of care, the quality of care we give to our patients across the health and social care. So what is quality in health nursing care? I did mention the Mid Stratfordshire Foundation trust scandal, and that actually, because the reason why most of these patients died was because the quality of care given to the patients was very poor. And so we really have to understand what is quality in health and social care. Cambridge Dictionary defines quality as how bad or good something is, but quality in health and social care does not have a specific or individually accepted definition of quality in health and social care. However, there has been some few dimensions or aspects with regards to quality in health and social care, which is safety, timely, effective, efficient, patient-centered, and equitable. I'm just going to talk a little bit about these. So when we talk about safety, safety simply means avoiding harm from care and with the intent of helping people. So in the process of helping people, or in the process of helping the patients, there shouldn't be an incident where the patients are harmed. So that's safety. And when we talk about timely, what we mean is that reducing unnecessary waste and delay. So if maybe someone raises an incident, it needs to be acted upon. An investigation needs to be carried out straight away, and the report should be able to, inform. The report should definitely inform the practice to improve the quality of care. Effective, when we talk about effective, we mean providing service based on evidence that has benefit. So this is when research, QI, which is a quality improvement project, service evaluation, and audit comes in. These are all strategies or ways to improve care. And so that's when effective comes in. And when we talk about efficiency, it's also about avoiding waste. So is there a way to use resources judiciously, efficiently, to avoid waste? It all part of, when we look at what quality really is, efficiency is part of it. You don't have to waste resources in the process of providing quality in health and social care. Avoiding waste is very important. And when we talk about patient-centered, so patient-centered means that in whichever service, whatever you're doing to improve the care, involve the end users. As a service provider, involve the end users. Mind you, they are the ones receiving the care. And so it is imperative that we as health professionals, whether it's research, whether it's audit, quality improvement, we have to involve the patient. If you've not watched my previous video on public involvement, I would really advise you watch. It dives a little bit more into some of the ways or the strategies to involve patients in the care we give, and ways to involve them to provide the quality of care, ways to involve them, especially when it comes to research, to inform the care we give to them. And when we talk about equitable, so equitable means that you provide care that do not vary in quality. So if I'm in Reading in the United Kingdom, and there is a care for dementia patients, it should be the same or similar to the care in maybe Hammersmith or in London. There shouldn't be differences. I mean, that sometimes depending on the culture, things can be done to tweak things a little bit to kind of meet the demands of the people, but that quality of care should not be too different from London, for whatever reason. All other things being equal, so it should be equitable. Whatever is done in Hammersmith in London should be similar or equal to that which is done in Reading. Basically, that's what equitable means. So first of all, we will be going into what really is research, what is audit, service evaluation, quality improvement in clinical practice. Today's session will be talking a bit more about it, but as time goes on, I'll be taking them each one by one, and then we'll talk a bit more about them. But with regards to, so just to think about these, anytime you think about research, audit, service evaluation, and quality improvement in clinical practice, remember these all come together. Actually, they work together in the quality space. So all these they're all tools or methods or strategies or ways to improve the quality of care we give to our patients. So think of the Mid Stratfordshire Foundation, scandal. If someone had raised, in your workplace, just think about it in relation to the Mid Stratfordshire Foundation. If someone raised, concern about patient not being enrolled and patient developing pressure ulcers and not being treated, or referred to the specialist, which is the tissue viability nurse, to come and have a look and provide specialist advice or therapy or treatment. Physiotherapy is not involved in patients' mobility, transfers and stuff. And so there were incidences of pressure ulcers, which, led to, wound sepsis and people dying out of that. No one reported it. Okay, fine. What if someone had reported it? If someone had reported it as part of a dimensions of quality, or things, the aspect of quality, which we talk about, effectiveness. If someone had mentioned it timely, there should be uh, uh, an investigation, a timely investigation with regards to whatever incident has been raised, and then based on that, an audit could be done, a research could be done, a quality improvement could be done, a service evaluation could be done based on that incident and the report, and then working alongside the patients, the staff, and everybody involved in that, area of care. That in itself is a process with which, you can improve care. Okay. And so when we talk about these, think about it in that way. Okay. So, or if something, even if there is no incidents raised, and you as a healthcare professional, you identify a need, or you feel that based on a study finding, this kind of area of practice or clinical practice should be looked at again. As a healthcare professional, we have the duty of care. We have the duty of care. We are supposed to, use these, the research, audit, service evaluation, and quality improvement to be able to improve the quality of care that we give to the patient, to be able to improve the quality of care with regards to whatever you have identified or whatever incident has, been reported, to be able to improve the care that we give. And when we talk about that, I just want you to think about it in that way, if that makes sense. So what is research? So research is designed and conducted to generate new knowledge. So with research, there are dimensions of research, okay? But the key thing you have to identify over here is you're generating new knowledge. In this case, you're not there could be a standard of practice, okay, or standard of care. You're not measuring whether the nurses on the ward with regards to the pressure ulcers are doing what they have to do. Maybe the standard of care on the ward is to tend the patients every 4 hours. If it was an audit, you would have been, assessing that practice against that standard of care, which is tending the patient every 4 hours, or the protocol or guideline. When it comes to research, you are generating new knowledge. So, for example, you have read that, turning patient every, or maybe you develop let me just say you develop a hypothesis that, okay, now we do not know. The standard of care or practice is saying 10 patients every 4 hours. And we have been doing that, and there are still incidences of, pressure ulcers on the ward. And you as a nurse, you think and say, why don't we do it every 2-3 hours? So, and there's no literature with regards to that, or maybe where in the setting you are, and it could have been done somewhere, or it could have been done, but there's a bit of a gap, maybe, gap somewhere, and then you develop a hypothesis. Okay, I believe that turning patients every 3 hours would work, because if 4 hours is not working, maybe we have to reduce it to 2 hours. And then you do a study based on that therapy. Obviously, that will become a quantitative study where you're testing out that 2 hourly rolling patient on that unit. And then you develop, methodology and all of that. That's part of the research process. That's a systematic research process, bear in mind. And then based on the finding, we come out to say, okay, we did a quantitative study among maybe 50 patients on this ward or this hospital or this trust or in the UK, and we realized that, okay, turning patient too early is imperative, or it's helps with, preventing pressure ulcers in patients with blah 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 blah. That's it. That's the finding. So now a new knowledge has been generated based on a hypothesis someone created, either because there was a gap in the research, maybe there is no information with regards to that, and so a concept or an abstract was created and a hypothesis was developed, and then based on that it was tested systematically using research processes. That is research. Now, what is service evaluation? So service evaluation is designed and conducted to answer the question, what standard does this service achieve? Okay, so when we talk about service evaluation, it is more to do with investigating the effectiveness or efficiency to generate information about the service. So, for example, turning patients every 4 hours on the unit, which we talked about with regards to what is research. With service evaluation, when conducting the service evaluation, you are investigating the effectiveness or efficiency to generate information. So what are the barriers? Why maybe there might be a reason why maybe you did an audit and realized that nurses on the ward are not really turning the patient every 4 hours. Okay, so now let's do a service evaluation. We're evaluating the service to see if what we're doing, we're really doing what we're doing. Does that standard, what standard does the service achieve? So we'll be thinking about, okay, what are the barriers to the nurses, not rolling the patient every 4 hours based on the audit. Okay, so you're thinking about barriers and facilitators of nurses on maybe in a critical care unit, maybe not rolling the patient every 4 hours or every 2 hours. So that becomes service evaluation. So you're doing something and probably did an audit and you realize it wasn't working. That maybe you realize that the nurses were not doing what they were supposed to do, and so you want to investigate the effectiveness and the efficiency to generate information about the service. Okay, maybe there is shortage of staff. It could be a barrier. Maybe there is not enough healthcare assistants to help with the roles and staff. It could be a barrier. So you're identifying the barriers and facilitators of that which should work and it's not working. Very good. So now let's go to quality improvement. So quality improvement is quite I don't know how to say, but I will talk a bit more about that as we maybe in our next session or something. But today's session, I want you to understand that when it comes to quality improvement, it involves using a systematic change method and strategy to improve patient experience and outcome. Okay, so we've not talked about audit here, but audit is very important when it comes to research, service evaluation, quality improvement, and even in itself. Okay, but with quality improvement, think about a method of change. Okay, you want to improve the care. You want to improve the care. The benchmark is quality. You want to improve the care, quality care. You may have undertaken a service evaluation, identified the barriers and facilitators, and based on the barriers and facilitators, you now sit down and then maybe with the healthcare professionals or stakeholders or the expert knowledge, you then devise on what might work, and you use a model to kind of tweak the kind of care you give whilst you're studying it. But this time around, remember, it's not systematic as research. And then you study that by, investigating a little bit more about the kind of tweaking you're doing and see if it works. Okay. It's not I don't want to use the word try and error, but mind you, whatever you're doing is not just any abstract idea. No. In this time around, you're using expert knowledge, stakeholders, people who are trained, have been doing that, they've got the experience and everything. You are also using evidence from research to back that. So you're tweaking care based on the available evidence, based on the experience of people, and theory of what might work. So that is quality improvement. Okay, it is a process. Okay, it's a process that could lead to clinical transformation. So quality of improvement could be just a small change, and then you build on that, build on that, build on that, and then it becomes a clinical transformation. So it's a very, very important process when it comes to improving the quality of care, which I said we'll talk a bit more about that. But just remember, it is about improving the quality of care. When it comes to service evaluation, you're just evaluating the service. You're looking for information, and then based on information, you can come up with an abstract idea which to generate new knowledge, which becomes research, or you can use that um, to undertake a quality improvement. Okay, so what is an audit? Audit is different from service evaluation. With an audit, it is conducted to find out whether the quality of a service meets a defined standard. So are we doing what the protocol is saying? So with regards to the nurses on the ward, who are looking after patients, and then the protocol is saying maybe roll patients every 4 hours or 2 hours. That's what the standard of practice or protocol is saying. And we realize there has been maybe 70% increase in pressure ulcers, and that has been raised. Okay, so now we know there is a problem. We have a standard of care which might not be working, or people are not doing what they're supposed to do. How do we know? We can't just sit down and think, or maybe people are not doing what they're supposed to do, and then we start going over. We start going chasing after the nurses. No, we have to. This is we're not doing things based on just thinking. It's good to understand why we do things, but when it comes to reports, we need to investigate, and the one way to investigate is through audit. So in this case, we need to know, is the standard of care, the protocol, not really working? Are they doing what they're supposed to do but it's not working? Or maybe we're not doing what we're supposed to do, and now we know audit has told us we're not doing what we're not supposed to do. Why are we not doing what we're supposed to do? Then that's when the service evaluation comes in. So with audit, we're finding out whether the nurses are doing what the protocol is saying. Okay, think about it that way. Now let's go to the next session. Just want to touch a bit more about what research, service evaluation, clinical audit. Here we didn't have the quality improvement, but like I said, we'll talk a bit more about the quality improvement involves service evaluation, research. Some of the with regards to evidence-based practice, the evidence from research are usually part of the process when it comes to quality improvement. Audit is also the PDSA cycle. We can talk a bit more when it comes to the quality improvement and all of that. But I'm just going to talk a bit more about research in relation to service evaluation and clinical audit. Okay, so when we talk about research, this is when you're generating new knowledge. Think about it that way. You're generating new knowledge. When it comes to service evaluation, it is to judge the current care. So we're judging the current care. With regards to the audit, you're conducting that to produce information to inform the delivery of best practice. Are we doing what we're supposed to do? What the standard of care is, advising us to do or telling us to do as nurses or doctors. Remember, we've got quantitative research. We have qualitative research. We have mixed method. All these research. But when it comes to service evaluation, we talk about what standard does this service achieve. So what standard that this service we're doing achieve, okay? That this service, reach a predetermined barrier, a predetermined standard. But when it comes, with audit, does this service reach a predetermined standard? So we have the standard, we have the care. Is a care meeting the standard? But remember, when it comes to service evaluation, we're investigating more about the efficiency and effectiveness to generate information about the service. Okay, you're investigating whether we're doing something or what is really happening that we cannot, achieve the standard of care. So it's more investigative, but this is more to do with, are we doing what we're supposed to do? So I'll add the link. You can have a read through, and then you can really understand the differences. But basically, that's the difference. Remember, with research, there may be randomization. Not all research are randomized anyway, but there may be randomization. However, when it comes to service evaluation, quality improvement, audit, there is no randomization. There's no allocation of interventions. There may be allocation of interventions in research when it comes to experimental studies and all of that. But with service evaluation audit, there isn't any of that. Okay, just think about that. When it comes to ethics, I'll talk a bit more about the HRA, which is the Health Research Authority. I've got a site, I think a link, where if you want to undertake a project, you could use that link. It would ask you some questions as to whether the project is research or not. So if it's a research, obviously you have to go through ethical, review, either in-house or external ethical review by the Health Research Authority Research Ethics Committee. So just something to be aware of. It doesn't mean that in as much as service evaluation, audit, quality improvement do not necessarily have to formally go through ethical review, it doesn't mean that you don't have to address any ethical concern when it comes to the research. Okay, so if you're using people, they need to have informed consent. You need to respect their dignity, confidentiality. All the aspects of ethics need to be addressed. If there's any risk, what benefit, let them know about it. They have the right. Just bear in mind. So how do we measure quality in our nursing practice? So measuring quality in our nursing practice, I mean, obviously I'm a critical care nurse, cardiac critical care and critical care nurse, because I worked in both areas. So I'm just gonna touch on based on what I know. So trained staff. I mean, if nurses are trained as a critical care nurse, we do our intensive care courses, which means that we're specialists in that area. If people are specialists, they've got in-depth knowledge, advanced knowledge about the kind of care they deliver to the patient. They're resourceful when it comes to doing audit, and even resourceful when it comes to undertaking research, undertaking quality improvement. Remember, it involves a lot of critical thinking, critical analysis, and all of that. And so, training staff, it's very, very important. Apart from the critical analysis, the critical thinking aspect, the writing, academic writing, and even to do with forming hypotheses, abstract ideas, how to correlate these, how to get people to think, and all of that is very critical when it comes to our nursing practice. Nursing is a profession. We have a code of conduct, we have a standard of practice, we have a body of knowledge, and so it is imperative that staff are trained, and is one way of measuring the quality of care. People need to be, trained even in raising consent, how to report, who to report to, how to get, these, when you whistle blow, do you follow up on that? Are you really concerned or interested in the care a unit gives to the patients that come into the unit or whatever? So it's very important because we are the ones who deliver the care, and so we need to know what we're doing. And one way of knowing what to do is by understanding what we're doing. Do we know why we're doing what we're doing? And if something is not working, do we know who to go to, how to go about it, and all of that? So protocols. So protocols officially, I mean, there are procedures or rules. The protocols for doing stuff on the ward. So if, for example, if we've got just try, so it's an official procedure. So for example, if they said, if hand washing, let's say hand washing, there are 5 processes of hand washing. There's a document, there's a document on the site in the hospital or wherever, which has documented this clearly on the ways to wash hands. Okay, and we do realize that maybe, and someone did an investigation and realized that nurses are not really washing their hands, or maybe they wash their hands, but after washing their hands, they did some, I don't know, maybe they did some swab and realized that they were not washing their hands properly or something, Now, why is it so? Because we have a protocol. So now we can do an audit to check, okay, are they doing what the protocol is saying? Okay, now they're not doing it. Brilliant. Is there anything that is preventing them from doing it? Then we do a service evaluation. Now we can think about doing a quality improvement. Is this something we have to tweak with regards to, the protocol we have, so that nurses will be able to wash their hands based on the barriers of the facilitators we did identifying the service evaluation. So think about it that way. So competencies are knowledge, skills, abilities, that contributes to an individual or maybe an organization, performance. So based on the competency, we can be able to measure, the quality of care nurses or doctors give to the patients. Standards, it works like the protocol. We have a standard of practice. It can be a way that we can benchmark the kind of care we give. CQC. So CQC, we're in the UK. So when we talk about CQC, we mean Care Quality Commission. And the CQC, I think, came about following the Mid Stratfordshire Foundation scandal, I believe. I'm sorry if I'm wrong, but I think it did, come following that. And these are all ways to ensure that healthcare providers are providing quality care to the patients based on the aspect of quality care. I think they've got some things they work with. So it's a measure of quality care. So if the CQC say that the care is bad, well, obviously, I don't know, but sometimes if it is good, they want excellent. But if it's good, there can be a recommendation on what they think that the trust or the hospital wasn't doing well and that they could improve on. So hopefully next time when they come, they could get to that excellent benchmark. They do investigate all these things. I think CQC does it well. We've got audit. Audit are ways to measure the quality of care. Remember, we've got the standard of care, and we use the audits to test out to see if people are really doing what the standard of care or the protocol is saying. And as a critical care nurse, we've got the guidelines for provision of intensive care services. When you go to the intensive care society, their page, you've got the GPICS, which has got the guidelines. So if as in a critical care unit, whatever we do should match the guideline. It might not necessarily be the same. There might be some tweaks based on whether it's a cardiac unit or a neuro unit or whatever. But whatever tweaks must conform to evidence-based practice, remember. However, the measure of quality of care needs to tally with what, GPICS, describe. So, HRA, which is a Health Research Authority to assess whether a project is research or not. So if you're undertaking a project and you're not sure whether you have to, I'm sure the research and development team in your hospital or in your clinical practice should be able to support you with coming up with whether it's a research or not. But if you're not sure and you want to be extra sure, I'll put the link there. You can click on the link. They'll ask you some few questions, and then based on the questions and the answers you provide, it can tell you whether the project is research or not. So thank you so much for watching. I believe we had a good time, and please like, subscribe, and share. And looking forward to our next session. Thank you. Have a lovely day. Bye.